name's Fiona Armstrong. I'm the convener of the Climate and Health Alliance, so we're very excited to welcome you here for the launch of our report, Our Uncashed Dividend. We're very excited to release this report with our partners, the Climate Institute. We're very pleased to work with another organisation that has a strong reputation for professionalism and effective advocacy, and we're particularly pleased to help support them to take a strong position on advocacy for climate action from a health perspective. Our Uncashed Dividend is a report that provides a badly needed injection of facts and evidence into the climate and energy policy discussion in Australia. This report brings together the evidence that is emerging around the world about the health benefits associated with reducing greenhouse gas emissions. It builds on a lot of previous evidence about how we can reduce the incidence of many so-called lifestyle diseases through health promotion activities, through healthier diets, increased physical activity, and reducing air pollution, for example. This recent work reflects the fact that it's becoming clear that many activities that cut emissions also improve health, and vice versa. Not only that, but the savings from avoided ill health and productivity gains that can save us billions of dollars a year, making an already strong economic case for climate action even stronger. Importantly, however, the benefits for health are significant and available immediately, while the climate benefits accumulate in the longer term. We hope that this report will serve as a reminder to policymakers and politicians that health must be considered in policy development in other sectors such as energy, transport, food and agriculture. And when it is accounted for, that strategies can be developed that provide a win-win-win, such as the situation that we describe here, that cutting emissions is good for health and it saves money. Here in Australia, we think about emissions reductions as climate strategies. However, the evidence suggests that they are actually extremely important public health strategies with climate co-benefits. In a political environment where we are seeing an extremely distorted debate on climate change, with state and shadow health ministers suggesting that the carbon price will hurt health, in my state of Victoria, the health minister has been suggesting that the carbon tax will put GP visits out of reach due to the rising costs, that hospitals will feel the full brunt of the carbon tax. It's regrettable that ministers of health would promote this misinformation, and as a leading climate and health researcher has commented, unrestrained carbon emissions are hardly in the interests of constituents. So that's why we see that this report can make an important contribution in helping to reshape the discussion around climate policies that is populated with confusion. In actual fact, there are many actions that we can take as a community and as individuals that will reduce our emissions and improve our health. The challenge for us as a community is to develop policy that will achieve both, which will bring us enormous benefits, not only as individuals, but as a society. We're very pleased that this report has strong support from leading healthcare stakeholders, including the Public Health Association of Australia, Australian Hospitals and Healthcare Association and the Australian Medical Association. We're also pleased to have the support and guidance of leading climate and health researchers in the work that we do. I'm very honoured to have Professor Tony McMichael, who is one of the world's leading climate and health researchers, here today to help us launch this report.
Well, thank you very much, Fiona, and congratulations first up to the Climate and Health Alliance and to the Climate Institute for putting this report together. I won't comment on the quality of the audience because I'm sure it's very high, but the modest size reflects in a way the slow process that we've experienced now for 2 decades in beginning to engage the wider public and policymaker in the discussion about the realisation that ultimately human-induced climate change, continued on its current trajectory, will lead to a great range of adverse consequences for the one species we don't talk about very much. We talk about the polar bears, pygmy possums. Ultimately, we must be concerned as well about the effects on the human species. And we've learned a lot in the last 20 years about the ways in which the different manifestations of climate change, the extreme events, the longer processes of background change, the disruption of communities, how all of these things lead directly or indirectly to adverse consequences for human health. So it's a signal moment, at least for me. I've been in this arena for 20 years, and for most of that time it's been very difficult to get human health on the agenda in the way it should be, as a central criterion, a driver of our policy. And the addition, the introduction into this discussion now of the benefits that can flow more immediately to local populations from judicious mitigation actions taken by governments and societies just enriches now the discussion and reinforces the case for taking early and substantial mitigation action. Mitigation, as I think we all understand, has as its primary purpose the long-term reduction or hopefully ultimately arresting of climate change in order to avert the whole spectrum of risks that we can foresee, some of which are now emerging. So that, from a public health point of view, is the first order of business, to actually eliminate the problem at source. But the second benefit and the focus of today's discussion is the collateral gains to population health from those mitigation actions themselves in a local sense. And it's important for us in this discussion to make that distinction. There are the longer-term global benefits to health everywhere from a reduction in a change in climate, and there are the more immediate and more localised benefits to health from taking those actions to avert climate change. And we'll hear from Tony Capon and others subsequently some of the detail about those benefits, that uncashed dividend. So I think it was nicely summed up in a quote from the editorial page in the Canberra Times this morning, which pointed out that the mitigation of climate change risks is now a core healthcare issue.
I've just been invited to say a few words about that positive story, and I think that's a key message from today, that we're talking about a really positive message here about climate change and health. And mostly when we talk about these issues, indeed many of the things that you'll be talking about here at the conference over these few days are about negative stories, understandably. And as health practitioners, we're responding to those things. But this is about getting on the front foot, and it's about a positive story. And I'd just like to say a few words about the evidence behind this, and a core of that is this special issue of The Lancet published back in 2009, and the focus of the whole issue was on these health co-benefits from taking action to tackle climate change. Tony McMichael is an author of several of these papers, and they range across issues from more active ways of moving around cities to the way we design our houses, the way we live in them, the quality of the air inside them, because that relates to the insulation we use and how we heat and cool those homes. It's also relevant to the diet, the food we eat. The food we're eating here at the conference is that vegetable-rich food, because that's the healthy food. And we need to make sure that the meat that's on the plate is more the garnish, as Tony McMichael would say, rather than the core substance of the meal. We're essentially hunter-gatherers, and we survive on the basis of that vegetable-rich diet. It's also relevant, of course, to energy generation. So the people who are living in the Hunter Valley and the Latrobe Valley will be healthier if coal isn't burnt in those valleys, and they don't have to breathe those toxic air emissions every day. Now, it's fine when you live in a place like Canberra and the electricity isn't generated in this place, but we're imposing that on those people in those valleys. Now, yes, if we transition to renewable energy generation, then some folks won't be able to keep doing the work they're currently doing. So it requires a broader economic transition and a safety net for individuals. But in the end, those folk, living in the Hunter Valley, living in the Latrobe Valley, will be healthier if we remove those toxic power stations. And those are just examples of the positives. They're explored more fully in the booklet, and I encourage you to have a look at it today and to take away a copy and to share it with friends. But I wanted to just make a couple of specific points as well. If we think about the way we live in cities these days, the more active ways of living are the healthy ones. So if we can walk, if we can cycle, if we can use the bus, train or tram, then that's less carbon dioxide emissions from that trip, and we'll be getting what we in public health call incidental physical activity from that journey. And we'll be healthier tomorrow and next week. Our physical health and our mental health will be better. Now, it's not just about cycleways and improving the conditions for the walking and cycling. It's also about where things are. So today I came here by bus. I caught the bus down to Woden from up at Balconnen, and then I walked across the park, and I had made the time to do that. So I could have come by car, but I chose to do it that way. But this hospital is actually quite a long way from Woden. There's not good wayfinding between Woden and here, so I had to get out my iPhone to work out, how I get around the cemetery to get over here. So, we will need a broader transformation in our cities to make this work, but we need to get on with it now for this additional positive reason. And my final point relates to the broader discussion in our society at the moment about productivity. It's argued by our politicians that we need a renewed focus on worker productivity for the future economic security of our country. Now, in this report, there's a mention of the productivity benefits from the sorts of actions we need to take. And I would argue that if we make that transition to a low-carbon way of living as a society, we'll have healthier workers and they'll be able to work better on a daily basis. Because people who are depressed, people who have chronic diseases, are not able to work as well as people who are healthy. So, yes, crack the whip over the Australian workers, make them work harder, but also enable them to work harder by being healthy. Thanks very much.
Actually, I'm absolutely delighted that this audience has an average age significantly lower than my Rotary Club. The reason is because actually it's time to look into the future. I do like to look into the past a little as well, and in fact I opened a number of these conferences while I was the ACT Health Minister, and that was before we used to change the data at hospitals and just do the count. But I do want to actually be quite serious about this. We are, the Public Health Association's involved in this for a very specific reason. You've heard a great deal of what Tony and Tony have said, so there's no point reiterating that. But what I would like to say is that these things invariably have an impact on the most vulnerable in our society. And so everything we do in the Public Health Association, we look at the social determinants of health and who it is that's most vulnerable. And for those of us who can actually have the education, look forward, be able to manage these things, but we should also be looking at others, and we should be looking to ensure that the sort of planning, the sort of action that is set out in this report is actions that we can all take, but those actions by their very nature will make those who are most vulnerable a much healthier people, and actually that's one of our largest responsibilities. Thanks, Fiona.
Thank you, ladies and gentlemen. I'm very pleased to be here on behalf of the AMA to support the launch of this report, Our Uncashed Dividend, the Health Benefits of Climate Change. Now, the AMA has been in this area, working in this area for some time, and has a comprehensive position statement on climate change that we've developed since 2004. It was updated in 2008. Look, this is a significant worldwide threat to human health, as we've heard, and it requires immediate action. And we recognise that human activity has contributed to climate change. Now, the sort of things that we're expecting, we've been talking about the health effects of climate change, and now we're talking about the health benefits of doing something about it, and they do dovetail together. The things we're worried about are heart-related illnesses and deaths, increased food and waterborne diseases, changing patterns of disease, in addition to their impact on health infrastructure and services. There's going to be more extreme weather events, droughts, floods, storms, and that'll be responsible for death and disease. Climate change dramatically alters patterns of spread of disease as well. We saw some of that at the Queensland floods last year, with Ross River moving further south, dengue moving further south, and there's potential for exotic diseases to take hold back in Australia. So this report collates much of the available contemporary thinking around the effects of climate change in human health and explains the benefits, as we said, through addressing the change in its causes. And it'll stimulate debate. It'll hopefully be a further catalyst for government and community action on climate change, and the AMA welcomes the report. Thank you.
Thanks, Fiona, and thank you to the conference for our ability to come and intrude in part of your time. So I'll be very brief. Very pleased to be associated with those that have done the work for this report. Fiona Armstrong, the lead author, to have the wise counsel of Professor Tony McMichael, who is on our board, and the support of Tony Capon on our Strategic Council, Michael Moore, and to Steve Hambleton from the Public Health Association and the AMA. So this is a very serious report, a serious issue, but it's actually also important to realise there are benefits of taking action. The policies that we have, which put a price and a limit on carbon pollution, are a welcome start, but the benefits that we can get from further reducing our emissions from coal-fired power, from changing our transport, putting better emission standards on, and beginning to look at the way in which we eat and work and live, are going to have some key benefits. Thank you once again to all those who have backed and supported this. Thank you again to this conference, and this is available at climateinstitute.org.au and the Climate and Health Alliance. Thank you.